we're joined by Nicola Hempton, a staff nurse from the Dungannon District Nursing Team. Hi, Nicola.
Hi there.
So do you want to start by telling us about your team?
Yes, I work within the Dungannon District Nursing Team, which is part of the integrated care team. It comprises of nurses, social workers, OT, physio and administrative staff. We cover the Dungannon area, Moy, Colisland, Ballygolly and Clogher. We endeavour to provide person-centred care that is tailored to the individual. We aim to prevent hospital admissions and we work with people with sometimes complex needs and help those patients to remain in their own homes or be able to return to their own homes from hospital.
And what about the role of district nurses specifically within the team then?
Yeah, district nurses, they coordinate the care for the patients, and that includes the care for acutely ill patients and people with long-term conditions, end-of-life care, and we offer elements of health promotion, immunisation programmes, and then patient education.
Nicola, I know you previously worked as an intensive care nurse, and suppose when we think of nursing, a lot of us automatically think of a hospital setting. Can you tell us about the different skills you need and the different experience you have working in the community compared to in the hospital?
Yes, to work in the community, you have to be well organised and you have to be confident and be able to cope in potentially challenging situations. It is essential that you're adaptable to change and are able to work in an environment without the resources at hand that you would have in the hospital. You have to be a highly skilled practitioner and be competent in a range of different clinical skills. Some of the things we would be dealing with would be people with tracheostomies, enteral feeding systems, central venous access devices, intravenous administration, wound care, continence care, just to name a few. I suppose the main differences between intensive care and district nursing. Intensive care is obviously very intense, but you always have somebody there, nurses, medical staff, where in district nursing you're a lone practitioner and you never know what you're going to face. We're also a bit like a ward without walls. We get referrals and there's no, that's our beds are all full, that's our limit. And we just keep getting referrals, so that offers its own challenges. And also, I find with district it's very different. In the hospital, the patient is out of their comfort zone. They're in this strange environment. All the staff know what they're doing and what's going on. Where in district nursing, we're the visitor to the patient's home. So we have to adapt to whatever we find in the patient's home. So that's very different.
Nicola, your team's been very much involved in the COVID-19 vaccination programme. I know that district nurses right across the trust have been vaccinating housebound patients.
Yes, obviously patients and families have been very anxious about nurses coming into their home, but they've also been really keen to get the vaccine. So we've had our own challenges in keeping up to date with all the new training that had to be provided. And then also the guidance that was in relation to that was updated regularly, so we had to keep on top of that. The vaccination programme was in addition to our already busy caseloads, but everybody within the team was keen to play their part and worked evenings, weekends, extra shifts, and then with the help of the brilliant administration team, we were able to deliver a very successful programme and vaccinated thousands of people that were unable to attend the GP surgery or the different vaccination centres.
Fantastic. You talk there about the patients being anxious about staff going into their homes throughout the pandemic. Do you want to tell us about any other challenges that COVID has brought to your team?
Yes, well, there was obviously the challenges of getting out to patients' home, but once the PPE was in good supply, we were able to continue visiting our patients in the home. The main challenge probably was the increased workload. As I've already said, it was on top of our existing workload. And then we were also working with different staff were isolating or shielding, so we had a reduced workforce really. So that was our major challenge.
Nicola, can you tell us what you love most about your role?
Yes, I suppose within district nursing, I've been doing district nursing job here for 14 years. and we have a wonderful team here in Dungannon. I'm very, very fortunate to work with such a lovely team. I love the fact that we're able to provide holistic care for the patient. We may be thinking we're going in, a patient specifically needs a certain wound dressed or something, but we find when we're there, there's X, Y, and Z needs done as well. So we're able to provide that holistic care at the time they need it. And I also love that we get to know the patients and families so well. I have patients that I've been going into for years, and you really get to know them, and that's lovely.
Lovely. I know we're at the start of what's looking like a really interesting time for your profession regionally. Do you want to tell us about that and maybe any other developments coming up?
Yes, it's a really exciting time for us in district nursing. There's a new district nursing framework that's being developed regionally, and it recognises the important public health role of the district nurse. So we're going to be involved more with health promotion and prevention, and there's going to be lots of new opportunities within our profession. Personally speaking, here in Dungannon, we have now got a new building, so there's lots of developments there with that. We are just waiting the final delivery on some equipment, but we're hoping to set up a PIC clinic. So that means patients who have a PIC line for administration of chemotherapy or antibiotics or different reasons. For those patients who are not housebound, they're reliant on the district nursing service. So they have to sit in their house all day waiting for us to come. Where we're going to have a PIC clinic where they'll be able to come to us, and we'll also then be able to do different teaching for students and staff that will assist them to gain their different competencies in the management and care of the central venous devices. So that's quite exciting for us here in Dungannon.
There's a lot happening there. We'll watch this space. Nicola, thank you so much for your time today, and best of luck to you and your team with all of those developments.
That's great. Thank you very much.